Good evening, everybody. Coach Armando Torres here. Super excited about tonight's call. We are on our summer schedule, right? And so we've been playing around with ideas of what day of the week, what time should we make calls and this and that and the other and see how we can benefit the most amount of people. And guys, I can tell you that it is like a camel. You guys know what a camel is? It's a horse put together by a committee, right? Because everybody got an opinion. So we are going to rock with these calls on Tuesday. Excuse me, on Wednesday nights are going to be our health insurance call. Everybody who is licensed or wants to get licensed or wants to learn more about the opportunity to get involved as a licensed agent, right? That's what this call is about. We're going to go into strategies. We're going to go into marketing, and we're going to go into how-tos. Those of you guys who've run with me for a while know I don't do rah-rah necessarily. I am high energy. I am jacked up and excited because, man, what we're doing is we're changing people's lives, right? We're changing people's lives on the product side. We're changing people's lives on the associate side. We're changing people's lives on the leadership side. So I get excited about that. But my goal, every call, my goal, every meeting, my goal, every time that we're in front of people is for you to walk away with a gold nugget and an action plan. If you walk away tonight and you don't know exactly what you need to be doing, then you need to call me, you need to text me, and we need to have a one-on-one, right? I'm and the leadership here knows it. And if you're upline leaders here, man, make sure you're connecting with them as well, right? Because we want to make sure that you know exactly what your next steps are so we can get it going. I want to share with you guys the important facts, important dates coming up and coming up real fast, real fast. So number one, we have Houston, Texas. We have the Houston takeover. In a few minutes, I'll put if somebody can put the registration link in the chat, I'd appreciate that. Houston, Texas, we're going to be doing a 3-day event in Houston, Texas, coming on the 22nd, 23rd, and 24th. We will have a full schedule here, but this is kind of what I want to share with you guys. On the 22nd, if weather permitting and the U.S. government does what they need to do correctly, highly doubtful, but if they do, we'll have our availability to do the AHIP, right? So we're going to get everybody in the office and we're going to do AHIP. We might do AHIP on Friday and do FFM on Thursday, but we're going to have AHIP and FFM certification on those days, okay? In the office, in Houston, anybody you have in the state of Texas, Louisiana, Oklahoma, anywhere within a 10-hour drive to Houston, make sure they're in Houston, okay? And then on Saturday, you guys are going to have a phenomenal event. We're going to bring in Miss Alina Garcia Barbon all the way from Miami, Florida. She'll probably be there all weekend with us as well, but she will be speaking on Saturday about international expansion. Guys, we are now able to do life, health, and wealth management, not only US-based, but all of Central, South America, Asia, Northern Africa, South Africa, and Europe, and the Caribbean. I had a question the other day. Can we do the Caribbean? Pretty sure that lands someplace in that hemisphere, right? So we don't. The only place we can't do is like Central Africa, right? So if you got somebody like in the Congo, we can't do Congo yet, right? But we'll probably, if you have a market in the Congo, we'll figure it out and we'll get people, we'll get carriers for Congo, right? We don't have a market for it right now, so we haven't done it, but we can go there. But anyways, you guys are going to have a special treat to be in the room. She's going to have as much time as she needs, and that's probably going to be like an hour, 2 hours to go into the nitty-gritty, show you guys. But she will show you how to do the business, and you walk out of there knowing exactly what you need to do to grow your business internationally. But the biggest run, the biggest deadlines right now are October 15, write this down, and November 1st. Medicare starts October 15. Obamacare or ACA or Affordable Care Act, whatever you want to call it, starts November 1st. The recruiting, I'm going to slow this down because I need you to get it. I need you to write it down, and I need you to live by this. The recruiting window is between now and about September 15. I'm not saying we can't recruit people after September 15th. I'm just saying it's a hot mess after September. right? Because everybody last minute, right now, you get somebody who's licensed, they come in and they want to get contracts. It's a beautiful thing, right? People in the contracting departments are like excited to see an application come in, because they're like really like color coding straws back there this month, right? They don't know what to do. They're bored out of their minds right now. But for us, and for those of you guys who are builders, those of you guys who are recruiters, this is the time to go hard in the paint. This is the time to go crazy recruiting, bringing in people who are licensed. They may have contracts with other FMOs. This is the time that they can move over their contracts pretty much smoothly, right? If they have a blockout for 90 days, they're still in time to come over, get their contracts in, and be ready to go for open enrollment, okay? If you're bringing in people who are freshly minted licensed, I love those, right? We can help them get their FFM, get their AHIP, get their Sherpa together, get all their stuff together so that they can start working, which is what I'm going to teach you guys tonight, how to work through the SEP, Special Enrollment Period, okay? And those of you guys who are not licensed, stand by for a commercial break. Get licensed, NAACP. Guys, I developed a great program. I partner with phenomenal partners through Snap. We're able to get people who are not licensed paid. However, they're getting paid through a lead generation program. If you want to get paid the big, huge dollars, then you got to get licensed. All right? It's like 4, 5, 10 times more money, depending on the product, if you're licensed or you're not licensed. Now, because of Snap and our partnership, all of the agencies, if you're with Xperia, if you're with Powerhouse, Bedrock, if you're Avid, doesn't matter. We're all able to use the Snap platform to recruit people who are not licensed and help them get paid. So you can still be here and not licensed and get paid, but you will get paid a crap load more if you're licensed. Did I say that in English? Pardon my French. Right? You get paid a whole lot more if you are licensed. So this call on Wednesday nights, I'm probably going to be running the majority of them, and we'll have people who have been in the field doing health insurance for a while running these calls with us. But these calls are designed to help you understand how easy the process really is. Okay? I'm going to start tonight by going over the Health Sherpa, okay, which is our platform that we use for quoting and closing, what I call a closing and quoting software engine. That's a big word that all it means is that this is where you're going to go when you have a client and you're licensed. This is where you're going to go to make sure that you're quoting them correctly and that you're closing them correctly, okay? Before I get into that, I want to make sure that you understand there's such a thing called a FPL, Federal Poverty Level Chart, FPL. And the FPL chart changes every year. FPL chart changes every year. The bar is moved every year, usually ticks up. You can Google it, right? Federal Poverty Level Chart 2023. And this is one of them. There's various, but this is one I like. And I'm going to use this. I'm going to use this for illustration purposes tonight. And I'm going to use this to show you how to read an FPL chart, okay? At first glance, it may be daunting. It may seem overwhelming. Let me see if I can make this bigger. How do I make this bigger? Amber, help. How do I make this bigger? Is it here?
You should have like a Zoom. If you don't have it for your Acrobat, you should have it in your browser. Maybe in the top right hand corner, like there's a settings thing.
There you go.
You see the Zoom?
You see, not only is she better looking than me, but she's smarter than me, and I love it. Hanging out with people. It's a great thing. It's a great thing. All right, here we go. Federal poverty level chart for 2023. 100% is really our minimum to write ACAs, okay? Obamacare, Affordable Care Act. I'm going to call it ACA, right? Shannon, did you have a question? I see your hand up.
Yes, this federal poverty level, is this a resource in the back office of PowerFin?
It is. It is, and I'll show you where to get that. But I'm going to put that here in the. I don't know if that. Hopefully that may work. I just put it in the chat.
Thank
What
you.
I did was I bookmarked it, guys. This is just a FYI for everybody. So in my bookmarks, I have a folder for ACA, and I put all the crap that needs to go in there for ACA, right? I have a folder for Medicare, and I put all the stuff that needs to go in there for Medicare. So in ACA, this is my 2023 FPL chart, okay? So that way I can access it fast if I'm in front of a client. So we'll go from there. All right, so if the family, this is household income, the whole family, okay? If the family's income is less than 100% of FPL, in America, they're considered poor, okay? Destitute, poor, I'm not sure what the politically correct word is, but they're gonna qualify for Medicaid in most cases. Medicaid is a state-run program, meaning that it's usually ran through the state, and they need to apply to the state. You do not get a commission. However, you may want to help people with Medicaid because their financial circumstances may change. They may need in the future Obamacare or ACA, and then because you help them, because you're their go-to person for health insurance, guess what? Boom, now you're. But I want to make sure you understand you're not going to get paid for Medicaid. If they earn more than 100%, up to 400%, they're going to qualify for a credit from the U.S. federal government. Let me repeat that for those of you guys taking notes. Between 100% and 400% of FPL, they're going to receive a credit from the United States federal government. And that's how those policies you'll see here in a second go from like $1,200, $1,300, $1,800 a month to $0, $4, $10 a month. Okay, it's because of this. If they make more than 400%, you're going to go off exchange. We call it short-term major medical. That's the typical term, but we call it off exchange. Okay. Any questions on this? Good. Let's rock and roll. So once you are licensed, right, you're going to have to take the FFM. And once you have the FFM, you can apply for Health Sherpa. You're going to go here to where it says sign in. Actually, you're going to go to sign. Once you're licensed, the first thing is going to be for agents. You're going to click here on the for agents part, and you're going to start enrolling. Here, you're going to go through the process. Please write this down. I'll put it in the chat. 31 Charlie 0. 31 little c 0. That is our agency code. 31 Charlie 0. That is our agency code. If you want to get paid, right, on time, every month, you need to do that, right? Because otherwise, our commissions team will eventually get a report, but you may have your commissions delayed up to 6 to 9 months. So if you want to get paid like right away, you want to attach your Sherpa to the agency. That way, every time that the reports run, we can identify who wrote the business and make sure you get paid. We're good? Awesome. So, and there's a little video here that explains to you all that stuff. Now, once you're signed up, you're going to sign in. For the purposes of this exercise, right, we're going to go up here. I'm going to share with you guys a couple of key ingredients. Those of you guys who are new, if you're in your Sherpa and you haven't yet done your agency connection, you're going to click here where it says agency. Oh, sorry. Settings. You're going to go down to where it says agency. And you're going to write the code 31 Charlie O. Sorry, 31 Charlie O or 31. You know what I'm going to do? I'm going to put this. I'm just going to copy this and put it in the chat so you guys can. I think it's 31 Charlie O or 0.
It is a 0.
It's 0, right? That's what I thought.
Okay, I just did it this afternoon.
Perfect. 31 Charlie 0. Okay. 31 Charlie 0. And then you're connected with our agency, which is New Health Plans and Powerhouse FIN. Okay. That's important. So that way we can see, your downline and we can help you identify, member counts and all that stuff. All right. So now let's go to actual quoting. You're going to click on quote on exchange. Let's call it a 35-year-old in Texas. And guys, stand by for commercial break for Texas. If you're not licensed in Texas and you're outside of Texas, make sure you go to nipr.com and get your license in Texas, non-resident license in Texas, right? Texas is probably the biggest, baddest opportunity in the country right now, okay? Followed only by Florida and California, but mostly Texas is a big opportunity right now. Let's just go to the numbers. 975,000 people in March were told that they were going to be put off of COVID Medicaid and that they needed to go get a Obamacare plan, a ACA plan. Another 1.8 million were told within 90 days. So right now in June, they need to go get an ACA plan, right, on the market exchange. And then Freddie did the math and did some homework, and he found out that 6.5 million people in Texas are uninsured that qualified for insurance. And then there's further math that 68% of the people in Texas who have Affordable Care Act went directly to the healthcare.gov and got their own plan. They did not use an agent. Folks, that is a huge opportunity. All right, a huge opportunity. You only need about 1,000 members, clients in total to make over $20,000-$30,000 a month. Okay, so when I tell you you want to get Texas rocking, you want to get Texas rocking. Okay, I don't care where you live on planet Earth, right? You want to get your Texas plan. So somebody give me a Texas zip code, please.
76549.
76549. All right, so 76549, and you go down here. If there's a zip code that has 2 counties, you're going to ask the client, which county do you live in, Bell County or Burnett County?
Let's go with Bell County.
Bell County. All right, perfect. Let's say this is a family of 4. Okay, let's say it's a family of 4. Now, for them to qualify for a special enrollment period, this family needs to make between $27,750. You see that? That's 100%. Up to 150%. So the special enrollment period that's happening year-round right now because of the CARES Act is 100 to 150% SEP. You're going to hear that word SEP, stands for special enrollment period. So let's say this family makes $40,000 a year. Okay, $40,000 a year. So you're going to go back to here. You're going to go here, and you're going to put 40,000. By the way, do not ever put a round number, because then it'll kick back and it'll say you got to, verify income and stuff like that. I know a lot of you guys have been calling me, man, I got to verify income on all my cases. Well, what are you putting? 40,000, 000, 42,000, 000, 16,000, 000, right? Always put some random number so that within reason of what they make, right? Don't be making up stuff. Right? But so here you go. So let's say dad is a 35-year-old male, right? Let's say mom is a 33-year-old female. Let's say the dependents, we have a 17-year-old male and can we have a 17-year-old with a 33-year-old? I don't know. I'm just gonna go with that. 14-year-old female, right? Now on this, you're gonna see that this family has a $910 savings, and it's saying that the kids probably qualify for Texas Medicaid. Okay, for the purposes of this show, we're gonna just click on here that they were just denied Medicaid or they were not on Medicaid, right? So that way we get a full understanding of what this family qualifies for. $1,551 credit. And you see where it says here cost share reduction? This discount lowers the out-of-pocket expense. And by the way, you saw what I just did there? If you see anything that has underlines like that, you just put your cursor over it and it's going to line it up. It's going to tell you what it is. This discount lowers out-of-pocket expenses, deductibles, co-payments, and co-insurance for silver plans only. So because it's going to do that for silver plans, the first thing we're going to do is we're going to come down here. We're going to change the deductible to $0 or as close to 0 as possible. There we go. $0. We're going to click on here, silver plans. And then you're going to click on carriers which you personally are appointed with. So I have Amber, I'm better twice for some reason, right? And in this area, that's all I have. Now, Blue Cross and Blue Shield, that's a captive company. We're not working with them right now. First Care, that's like a little regional one. If we have a lot of business there, we'll get appointed with them. We're not appointed with them right now. Scott and White, we are appointed with them. I haven't done my contracting. I will. And then US Health and Life, right? Those are the ones that are in that area. But Ambetter is the one that I am appointed with. So here are the options. A $1,630 plan is going to cost this family $79 a month. You guys see that? After the credits were applied. It's a 0 deductible plan. Maximum out of pocket, and you could highlight this, right? What does maximum out of pocket mean? Is $1,700 for the year. Okay, that means that once you've reached your out-of-pocket maximum, your plan begins to pay 100% of the allowed amount for covered in-network essential health benefits. Costs that count towards your out-of-pocket maximum includes deductibles, co-insurance, co-payments, similar charges. Okay. Doctor's visit is no charge. Specialist $10. Generic drugs, no charge. I like to give them a few options sometimes, so we'll click compare. Now watch this. This next one is $80, so a couple cents more, but it lowers the out-of-pocket minimum. That's your out-of-pocket maximum, and it lowers the specialist from here to here. So I click compare. And I may compare one or two more if it makes sense. In this case, none of them really look like they make sense. Okay. Now, once you have the comparison, you can always look up the doctors. You click on here, and if they have a specific doctor they want to go to, you can click there. If they have a specific drug that they're on, right, like Jardiance or metformin or any medication, you could look it up there. All the benefits will be there. But here, I like to click compare, and this gives you a side-by-side comparison of the plans. So here, they're both silver plans with Ambetter. They're about 20 something cents apart, right? 0 deductible on both. 1,700, 1,200 estimated all in. They're both the 2-star plan in that area. That doesn't really mean much because sometimes it's the only options, right? They're both an EPO. Let me explain to you guys, those who are taking notes, what the difference are. You have an HMO, EPO, and a PPO. HMOs are probably going to go away soon. HMO require the patient to go to their primary care physician to get referrals. A PPO does not require any referrals. An EPO is a hybrid, and for the most part, you don't need referrals. Most plans that you're seeing in 2023 and in 2024 are going to be EPOs. Okay. Primary care, no charge, no charge. Specialist, $5, $10. But watch this. Emergency rooms, it's 25% versus 30%. So one hand giveth, the other hand taketh away. Right? Hospital stay 25%, 30%. And again, up to the maximum out of pocket, right? So if they go to the hospital, it's $150,000 because of a heart attack or a stroke or whatever, 25% of that up to $1,700 is what they're going to pay. Okay. You go into more plan details, summary of benefits, blah, blah, blah. Summary of benefits is real important. Medicare, I'll teach on that in the next couple of weeks, not tonight. But for the majority of the cases, guys, ACA is for general population. Most people don't go to the doctors all the time. Most people are not really worried about all this stuff, right? And those that are, then you're going to send them a summary of benefits. But a majority of the people, they're going to be, they just want to have something in case of catastrophic, right? They end up with a heart attack, a stroke, a car accident, or something like that. So once you have identified which plan they like, you click on add to cart. And you can either start application or add a dental plan. I'm going to teach you guys dental plans in the next 3 weeks because we are working with United and Humana, which are not on exchange ancillary products that are much more comprehensive, much better plan than the crap they sell on exchange. Did I say that out loud? Than the stuff that they sell on exchange. Okay. The Humana dental and mental and vision is better, and so is the United. Shannon, do you have a question or a comment you want to bring in? Shannon's an expert in this stuff, so I love to hear from him.
Yeah, mine's I guess maybe an advanced question. To cover the hospital, the 25% there, and the ambulance possibly, would you want to sell a hospital indemnity plan with this?
That is an advanced question. I'm not even talking about that today. We will talk about that on the night that we talk about ancillary products in the next couple of weeks. Okay.
All right. Thanks.
Yep. Man, some of you guys are smarter than me, and I have to go do my homework and then come back and talk to you. So, anyways, viewing cart, boom, and then start application, and then you're off to the races. 4 to 7 minutes, you should be done. What this part is going to do is going to look it up in the marketplace. Okay, so if they are in there in the marketplace already, right? They may have an application in there. You're going to use that application and make any modifications that you need to modify, right? Hint, hint. You guys working in Texas. You pull up, John Doe and birthday 1/30/77, state of Texas, and he comes up down here and it shows that he has an application. Please listen to me. It may sound illegal what I'm about to tell you, but it's not illegal. And it's actually one of the exciting parts about working in Texas. John Doe may have gone directly to the health marketplace and gotten coverage. And he may have that $79 and better plan. If they have health insurance, you quote it and go through the process. If they don't have health insurance, you quote it and go through the process. Lowest common denominator, you quote it and go through the process. Let's say Julius is my client and I put him in here and he has an application in there and I go through the application and it turns out that and better program is the best program for him. Because I went through the application, at the end where it says NPN override, you add your NPN and then you just adopted that client and everybody that's in that household. So if the PMPM per member per month in cash is $25 per member per month, and Julius has 4 people in his house, mom, dad, and 2 kids, and I left him on his plan, but I added my agent ID called an NPN. I added it to his profile. I have adopted that client. So it's 25 times 4. I just gave myself $100 a month pay raise. That sounds illegal. It sounds immoral. Sounds unethical. But it is what it is. It is the system, right? The government is saying, here, Mr. Agent or Mrs. Agent, here is some money. Thank you for helping this person out. Thank you for helping this family out. Guys, I want to get not political, but I want to get philosophical with everybody. The reason
Question.
why Obamacare, Medicare, I'm sorry, the Obamacare ACA is so important is because prior to this law being effective in 2011, 2010, prior to the law, when people got sick, they went to the emergency room. And that emergency room bill could be $50,000, $100,000, $200,000, $300,000. And if they didn't have the money, guess what? That whole bill went to the state, to the government. So it is our patriotic duty to get as many people as we possibly can on this plan, so that everybody's contributing into the plan. The more healthy people that are on the plan, the better it is for the whole United States economy. Not that the economy is in good shape, but nonetheless, if we could do our part, right, it is beneficial for people to be on the Affordable Care Act. It is beneficial for them to be on the Affordable Care Act. January of 2016, a buddy of mine convinced me to get, my family on an Affordable Care Act plan. I go to the doctor, I run blood tests, this, that, and the other. Turns out I had diabetes, high blood pressure, this, that, and the other. Doctor said, man, you would have been dead in 6 months if you didn't come in to see us, right? That happened to me.
I got a question.
Yes, sir.
Yeah, Mr. Julius had better policy that was already there. Would it mean that if the policy had been approved and he had started benefiting from it, so will you still have to put your NPN number there and be paid?
Yep. You can adopt any client in the whole system at any time throughout the year.
Okay.
Yep. Pretty cool, right? So Fejo will be at the event and he'll tell you he's a healthcare affordable care nut, right? He reads every news article and everything, and he'll tell you that 200% more business is done on the SEP than it is during the AEP, right? So during this time of year, the people who are actively writing business, right? What are we writing? We're mostly writing people who already have Affordable Care Act. We're just making sure they got the right product and attaching our NPN number to it. Okay. So that's how you build your book of business. FPL, Health Sherpa. Those two are going to be your day-to-day operational babies, right? How do you get licensed if you are not licensed? Or how do you get your people licensed if they are not licensed? Very simple. You're going to go to app.powerhousefin.com. And you're going to click sign up. Oops. You're going to click sign up right up here. If you are not with Snap, cover your ears for 2 seconds. If you are with Snap, your mentor is going to be snap@powerhousefin.com. snap@powerhousefin.com. If you are with Experior, your mentor is going to be Experior@powerhousefin.com. Experior@powerhousefin.com. Okay? And anybody else, you're going to use whoever invited you here, right? So whoever is your upline, you're going to use their email address there. Okay? Ms. Gail. Questions?
Yes, I have a question. So when you're doing the quoting on that front page on the Health Sherpa, do you not put the provider name over there so that you can see what the doctors take, what plan that they take or accept?
Yeah. So if you want to go there, you go down here and you go to prescription directory, or if you want to go to plan details and you want to go to the doctors and all that stuff, you can do all that. Yeah.
No, I'm talking about the other page where you put in the household number. Yeah,
Right here.
here. See over to the side, it says provider. To the
Sure.
right
You
there.
can add, yeah, if they want a specific hospital in the area, or if they want a
Mm-hmm.
specific prescription, you can definitely add it there, and that'll help the system, get you the right plan. Absolutely.
Okay.
Absolutely.
Thanks.
Yep. I'm working with an agency now, and they do personality profiling by colors, like blue, red, green, or whatever. I use DISC, right? So people like you that are big-hearted, want to do the right thing, making sure you get it right. That's you. That's you're high S, right? That's cool. You can definitely do that. People that are the high Ds are reds, are drivers. I ain't about the detail. I just go hard, right? Figure it out on the way. But yes, you're right. You can providers. You can do as many things as you want in here. In fact, one of the things that I do here is, let's say the $79 is unaffordable, which is bull, right? Because if they make $40,000 a year, they should be able to provide for their family $80 coverage. But if they say that they can't, right, then I would go up here and change the max deductible as an example, right? And usually that lowers the plan. Or you can go up here and put minimum premium, right? Or whatever. You can definitely play with all these deals up here. You can go with a bronze plan, right? Let me see if take off the silver plan. Somebody give me like a Houston or like a big, because my man Freeman just gave me like a country zip code. Somebody give me like
77018.
All right. Freeman, you give me a country zip code, man. Sometimes when you're out in the country, you got limited plans, right? But here we go.
But that's where I am in the country.
I know you are. Yeah. That's cool. That's cool. But look at this. If you're like in Houston, right? You get a $0 plan, zero deductible, you can get a very affordable, right? Real affordable. So you go here, you click on silver as an example, right? And then you get look at this. You get that same Focus Silver plan that we looked at a little while ago. Here is $0 a month, $0 deductible, $1,200 out of pocket, no charge, $5 no charge, right? That's a $0 plan that takes care of all 4 people in the household. There's no chargeback. That person ain't falling off the books. That's a solid business, right? Those of you guys taking notes, write this. 87% of everybody in the United States of America, 87% of everybody in the United States of America that are on the Affordable Care Act today pay less than $10 a month. Folks, they ain't never in the history of America been a better business opportunity than this right here. Those of you guys who've done network marketing, tell me a network marketing company on Earth or on any planet that the family pays less than $10 a month and you can make $100 a month in residual on any product. Name me one. Sorry, I get emotional. I get excited because, you walking in there selling $0 and you're making money. That's like crazy. I think we have somebody from the great state of Mexico, Miss Beatriz. She's on the other side of the border tonight.
Yeah, I'm in Mexico actually. I have a question regarding, you said the special enrollment period, it's if you're 100 to 150%?
So that's one. If they just moved, that's another one. If they just changed employers, that's another one, right? So there's different SEPs. I just showed you guys one SEP. In the next couple of weeks, I'll have a meeting on all SEPs, but the major ones are going to be 100 to 150%, move and change employer or change in family dynamics. Somebody gets married, somebody has a baby, somebody dies, somebody gets divorced, right? Those things trigger SEPs as well.
Okay, so if I have somebody that lives with their daughter, but she's considered poverty. I mean, she might qualify, and she says she qualifies for Medicaid, but she does not want to go with Medicaid because she's in the process of getting her American citizenship, and she would hurt her sponsor. Can she buy Obamacare? Can she get Obamacare, or not at all if she qualifies for Medicaid?
So by definition of qualifying for Medicaid, it depends on her income, right? Because a lot of people came over the border, or a lot of people have been qualifying for Medicaid because of COVID, right? So let's touch base. If she qualifies because of her income now for regular regular Affordable Care Act, then you want to put her on Affordable Care Act, right? If she qualifies, but if she doesn't qualify, then you know the best thing for her is Medicaid, and there's a lot of misinformation out there, and I don't want to get political on tonight's call. There's a lot of misinformation out there, and pobrecitos, a lot of people are giving the wrong information. Oh, if you go on Medicare, if you ask for food stamps, this and that and the other, and so it really comes down to, you know, on a case-by-case basis, and I'll help you with that. So reach out to me on a one-to-one with that. But majority of the times today, if they're on Medicaid because of COVID or whatever, let's just quote them out based on the FPL. If they make over 13,590 as a single person, quote it out. See if the system takes it, and the system will probably take it.
And you also said that there's dynamics that can change, and they're going to qualify to do the special enrollment period. How do they know? How do they know if they moved? Let's say this lady that moved from one daughter to another daughter, or
so it's going to be based on their income taxes. So everything here is based on their income taxes. So let's say you have a mom that lives with a daughter, and the daughter is married with kids. The daughter may declare taxes with her husband and the kids, but not declare her mom as a dependent. If her mom has her own tax return, then she would qualify as a single person. If the daughter, because the mother moved in, declares her mom on her taxes, or intends to declare in the following year her mom in the taxes as a dependent, then you could put mom, instead of being a 4-member household, now it's a 5-member household, right? And you're going to see that a lot. You're going to see that a lot, guys. And as the economy gets, you know, as the economy get gooder, psych, right? You're going to see a lot more, right? And, you know, I live, and my hometown is Miami, Florida, right? When I was growing up, most folks down in Miami, you know, you live with mom, dad, and your siblings. Now you live with mom, dad, your siblings husband, your siblings wife, your sibling, you know, baby mama, your sibling, your siblings grandmother's mother, you know, daggone 50 people living in the house now, right? It's crazy, but you got to, because that, you know, rent down there is like $7,000 a month for like a 2-bedroom apartment. So you're gonna see that. I say again, I ain't trying to get political tonight. Just trying to make sure that I bring home the point that you're going to see multiple generations in a home now, right? So this whole thing is based on next year's taxes. How are you going to declare next year's taxes? Are you adding your mom to your tax returns? All right, so now that 4-member family becomes a 5-member family, right? Your sister had her last year as a dependent, but now this year she's going to be your dependent. Well, your sister goes to a 4-member family. By the way, let's go write the sister. Hint, hint, right? Let me get your sister's number right quick. Let me have a conversation with her, right? And now, boom, you go and write this one, and you write that one. Follow me?
Recently moved from daughter to the other one. Is there any way I mean, does she have to prove it, or how would they?
Nope. ACA is wild, wild west. As long as next year on the taxes, you declare her, that's how they prove it. It's how you do your taxes, how you do your tax returns.
Oh, okay.
And how you do next year's tax return. It's not even like this year's tax returns. Like, how are you planning on, you know, writing next year's tax returns?
Can somebody be dependent when he's making income and declaring taxes?
Yep.
Oh, okay. That makes it easier.
Yep. All right. Any other questions on that?
Mr. Armando,
Yes, sir.
I got a question. I came up across somebody a week ago. I was talking to him about the healthcare, and they mentioned to me that and this is just something I just want to know. Do they, when they file their taxes, do you know if certain credit gets removed from them being able to claim because they used Obamacare? I haven't heard anything about it. I mean, but they mentioned this to me. They said, I don't want to lose, that either. I was like, is my family used this last year, and now that we try to file, it hurt us from that credit. I was like, oh, really? Okay. Well, let me look into it and I'll get back to you. So just want to run that by you.
Yeah. So what happened was, what happened was, you're gonna find some unscrupulous agents out there sometimes, and for them to get the deal done, they'll put the wrong income, right? So you'll see sometimes, a person will tell you, oh, I tried that Obamacare and I had to pay $3,000 at the end of the year. Well, that's because the agent put the wrong number in the income, and you were getting a bunch of tax credits that you didn't qualify for, right? So you either pay now or you pay later, right? So that may be a situation there. But as far as like, if you do it right, the credits are going to report on a form that gets mailed to you in January, and you give that to your CPA, and you should be okay.
Right. Okay. Thank you. And it makes sense. I mean, what you said, and I believe it. So, okay. Thank you, sir.
Good. I'm going to go real quick. So once you sign up, it's going to give you a document, show you how to get in the system for your licensing. I'm going to go real quick. I'm going to sign in. So if you're already in the system, in the Powerhouse system, you're going to go here to where it says get started, and go down here to where it says licensing and contracting. Okay. And here's going to share with you how to get your exam, your class for $39 or $59. Okay. Just because of tonight's recording, I'm going to go ahead and show you guys that. You're going to go to www.examfx.com. Those of you guys who are not licensed, pay attention to this portion of the show, please. So you're going to accept the cookies. Purchase now. You're going to go to special company discount pricing. Here, you're going to put home office at Powerhouse FIN.com. Okay. Special company discount pricing, home office at Powerhouse FIN.com. Guys, we negotiated these prices for you guys. Let me just show you with you. Like, if you're going to do, make sure you go in here and you do life and health. Life and health. Leaders, listen to me. Life and health. When you get people in the system, life and health. Because if not, you got to do life, and then you got to do health. And in some states, like Texas, if you just do health, you're going to have to go back and you're going to have to do health and life. Or if you do life, you're going to have to do life and health. So avoid the heartache. Did I get dramatic enough? Y'all feeling my heart? All right. I need you to understand. Please help me help you. Life and health. So if you go here and you click on learn more, the course is $169 for the self-study. If you put the discount code, it drops down to $39. All right. If you and you could hear, you see the self-study package is $169. The video study package is $219. Right? Live package, live in-person package. You have all these different packages. But whatever package you choose, right? Let's say you do the study course. I like the live online. This one goes from $299 from three. This is the best value. You click on here, register now, and you click on home office at powerhousefin.com. You click next step. You click on free licensing, insurance, free licensing in the state of, I don't know, Texas, right? Life and health, please, life and health. Life and health. Next up. And you see, guys, it drops down to $60.59. Oh, they just put it up a couple cents, right? It used to be $59. So I guess Biden inflation or whatever. So you just choose that plan, right?
What about this one, life and health below?
Yeah, that's a self-study plan. Okay.
Oh, okay.
This was going to give you online study package. So twice a week, they're going to have classes, but here, this one doesn't have the online study. Whichever one you want, doesn't matter, right? Click next step. Boom. Oh, I just dropped it to 34.95.
And I assume these are like video presentations at the self-study where you can just read through it. It has little quizzes at the end of it.
Yep.
Yeah, it's pretty easy then.
Oh, it's super easy, guys.
Yeah.
Super easy. The income really goes up, guys, for those of you guys who are with Snap, right? Everybody else, we've always just got to get licensed. That's the only way to make money. But I know in Snap, we have a system that you can get paid if you don't have a license. But you get paid like 4 to 10 times more income if you're licensed. Get licensed. Please get licensed. Go get licensed. Please. All right. I'm going to open up for Q&A for a few minutes here. Anybody who has any questions, comments, or concerns? Folks, I hope you got, at least if you're in this call tonight, you know what your next step is, okay? If you're not licensed, get licensed. If you're in the system and you want to build an agency, start recruiting people into your agency and help them get licensed, right? On the 22nd of June, I will be in Houston, Texas. Those of you guys who are going to be with me live, be prepared that on that day, we're going to work on FFM and or AHIP on the 21st, the 22nd and 23rd. I want everybody in the organization to be fully contracted. Guys, those of you guys who are new, disregard what I'm about to say. Those of you guys who've been running with me for a minute, we are not doing NPN overrides this season. You have to have your own contracts with all the carriers. If you don't know what I'm talking about, don't worry about it. you weren't in that hot mess, right? But if everybody needs to have all your contracts with Powerhouse ready to go with all the carriers in the markets that you're licensed to do business with. Okay. We're going to do FFM together. If you're not in the Texas market, we're probably going to open up a Zoom and you guys will be able to jump in and knock out your FFM with us, right? And knock out your Zoom, your AHIP with us, right? For 2024, right? And then on the Saturday, we're going to go from 9:30 in the morning to 4 in the afternoon with training. And the guys who were in Dallas last week can tell you that training is going to be overwhelming. It's going to be drinking water through a fire hose, but at least you're going to have a good, clear, concise mental picture of what we do here at Powerhouse, right? With any one of your agencies. And by the way, we're the only IMO that you can come in as an agent and you can start your own agency and then become an MGA and then grow and become an SGA and go become full partner, right? I'm a full partner now. So what that means is that we pick up all the back end overrides that you can't do anywhere else, right? Like here, literally, you join, you don't even have to be licensed and you can override a team with our partnership with Snap, which is exciting. And we're going to talk about that more in detail in the next couple of calls here. All right, Debbie D. I like that name, Debbie D.
Hey there, how are you?
Great, how are you?
Perfect. So my question was, I have two questions. First question is, how long does it take to get licensed?
So the record in the company right now is 4 days. I think, and that's outside of me. I did it in 3 days. I actually did it in 2 days. So I found out about health on Thursday. I studied the course on Friday, and I went to take it on Saturday. But I'm a freak of nature. So outside of me, it's 4 days. So I'm trying to have somebody beat my record, but outside of me, it's 4 days.
Okay. The second question is, when you adopt a client and take over their file, is it likely that another agent from another place had that file before and then would get notified that they've lost that account? How does that work?
So they're not going to get notified that they lost their account. If they're paying attention, they will see it in their report. But if you're afraid of agent confrontation, just let me know. I'm Cuban from Miami. I love brawls. I got your back.
Okay, very good. Thank you.
People walk away from here and be like, man, I don't like to fight. Yeah, I know. It's been a while, though. It's been a while.
Yeah, Armando.
Hey, John, how are you, buddy?
Good. Two questions. Number
Yes, sir.
one, how long does the average client or buyer stay with an insurance plan? And then question number two is, I started on the self-study, but I think it would be helpful to have interaction with someone else. Can I upgrade?
Absolutely. So thank you for those questions, and they're awesome questions. Let me address the first one first. Actually, yeah, while I look up here, exam FX support. So I will write in the chat the exam FX support chat number. Exam FX support. That's going to be 800-586 2253. 800-586-2253. So you can call them and definitely upgrade and get that going. So to answer your first question, John, this is why I'm in love, like literally in love, not just because I created it. I mean, I created it because you know, I've been in your shoes. I was in the field. I was a network marketer day one at one point in my career, in my life, right? Through network marketing, and the way that we do business, network marketing is a sticky customer, right? It's your sister, it's your brother, it's your cousin, it's your best friend. It's a person that you recruited and their sister and their brother and their cousin and their best friend, right? So I don't know about you, but if my sister gets an insurance policy with somebody else, right? I'll beat her ass. Excuse me. We're going to have a conversation, right? Like, you ain't getting your insurance policy from no, I'm your brother, right? Like, yeah, like you're only eating mashed potatoes, no gravy at Thanksgiving, right? Does that make sense? It's a stickier customer through network marketing, through how we do business. In the insurance world outside of Powerhouse and outside of our environment in the industry, the average customer sticks through 1 year, max 2 years. That's the average, because they're shopping it around. For them, there's no loyalty. It's all about the price. It's all about what can you do for me lately, right? But in our environment, we tend to have customers stick around for a longer time because, again, they're your family, they're your friends, they're the friends and family members. And then, you know, Amber will be sharing Rainmaker in a few weeks, and what we do through our CRM and constant contact, and you know, getting people understanding. Like, for example, Ambetter has a phenomenal client portal. Ambetter has a phenomenal client rewards program, right? If you're with Ambetter and you go to the doctor and you pick up a couple of prescriptions and this and that and the other, you know, I just got $100 gift card from Ambetter, right? So, you know, but we'll teach people how to use their products and how to use their programs and stuff like that, right? So what we do differently than most insurance agent guys, like our competition literally works from like November 1st through like December 3rd. They get enough business for them to feel comfortable and happy. And then they go into winter break, Christmas break, they go into a lull and they don't come back until the following year. In our environment, we nurture our clients, right? In our environment, we're going to nurture our clients, and you know, again, they're your sister, your brother, your cousin, your best friend, right?
Very cool.
Yeah.
Thank you.
Good. And guys, I see like we have like 30 some people on the call tonight, right? And I'm going to tell you guys this. This is a race like there's never been a race before. I don't care how good you are. I don't care how good I am, and I'm good, right? I can close, we can close. But this is a crusade. There's millions. I talk about Texas, but guys, Florida's big, Georgia's big, South Carolina is big. Every state is big, right? We need an army of people to come in to help us with this crusade that everybody in America needs to have universal health care. The law is in the books. I just showed you where it's like $0, $10, $80, $50, $30, $0. It's not a lot of money. Everybody in America needs to be on an insurance plan, and everybody in America needs to be on an insurance plan where you're getting paid. And the more people you have on your team, the faster you grow in this organization, the faster you start picking up those back-end dollars and those marketing dollars, and there's a lot more dollars, right? I had the pleasure today and the honor to step in with my brother Andres Bernet, right? We were talking. I said, Andres, brother, if you get in your entire organization 100,000 clients, and you make $1 override, $1, un pesito, $1, and you have 100,000 in your organization, that's $100,000 a month override. Man, we're back to ordering from the left side of the menu, right? You're ordering. Do you guys know that every restaurant in the world is an all-you-can-eat restaurant? As long as you keep ordering and you can pay for it, they'll keep bringing you food, right? Mind-blowing to me, right? Enjoy life. You can drive the car that you want, the house that you want, right? It's just a matter of getting out there and building an organization that goes out there and does what's best for the clients, right? Tonight, we just talked about one piece of the puzzle, one piece of the house, our foundational first floor product, right? Health insurance. We got Medicare coming next. Next week, we're going to be talking about Medicare and how to quote Medicare, how to get people on Medicare, right? And then we're going to talk about international, and we'll have Alina show you guys how to do international healthcare, right? Now that's big money right there. Those are big policies, big money, right? Everybody needs to be on healthcare. All right, last questions here. Coming up at the top of the hour. I hope you guys are excited as I am. I'm excited. I'm jacked up right now, guys. I can see with this team, with where we're at, where we're going, we're going to help a lot of folks get the right coverage. We're going to make sure that everybody gets taken care of, right? Whether you're licensed or not, now you can do business with us. If you're on the team, it doesn't matter which organization you're with. If you want to learn more about helping grow a team of non-licensed people, reach out to me, and I'll show you guys how to work with our SNAP partners and build your non-licensed team as well, which is pretty exciting, right? We're going to rock this all the way up. We have our top incrementer at this moment in time. We are in June. Actually, I'm sorry. I'm going to talk about May because I haven't seen the June numbers yet. But as of May of 2023, our top incrementer right now makes $27,000 a month residually, right? And there will come a time, I'm telling you right now, there will come a time when people in this organization will be making $30,000, $50,000, $70,000, $100,000 a month, maybe even more. The only way to do that is to go grow a huge organization. My name is Armando Torres. It's my plum pleasing pleasure to be with you guys tonight. Love every single one of you guys. Let's go out and build it big. Talk to you soon. Good night.